How do we recognize the signs and symptoms of suicide, if there's such a thing out there?
It absolutely is. I mean, suicide is generally preventable in the sense that there are signs that happen beforehand that you can look at and really help people figure out how to get the help that they need, like they did with you. So a couple of things. The first thing is a change in behavior that you've seen. Usually the people who are closest to someone, just like with a heart attack,
Right.
they see these symptoms because they know what your baseline is. They know what you are when you're not dealing with problems. And so if there's activities that people used to like and they don't like, we call that anhedonia. Well, that's a sign. If there's they've been feeling down for a couple of weeks, it's not just a passing type of feeling. That's another big thing. Another big thing is if people start giving away things that they used to care about. So all of a sudden they want to give you, the
favorite book that they had.
Exactly. Exactly, something like that, and you wonder, oh, that's really nice of them, but I thought this was something really important to them. Well, this might be their way of getting their affairs in order and saying goodbye. And so, and especially if someone's experienced a big loss, they've had a big breakup recently, they've lost their job, maybe there was a divorce and the kids are no longer in their life. All of these things are huge risk factors.
I think depression also has a lot of medical component and health component to it, and how it affects, whether it's constipation, whether it's lack of sleep, whether it's all cardiovascular stuff, the effect of this. And I think recognizing those are also important. But your point is well taken. Not engaging with your society and your friends, and that withdrawal is a big part of it, and recognizing that is absolutely important. Okay, so you realize that somebody is about to commit suicide. What kind of help is out there? How easy to get that for a lot of patients out there?
Yeah, there's a lot of great resources that are available. But one thing, to your point that you were talking about, the biological components of not having sleep and dealing with appetite changes, that really does affect your decision-making process. And what we see as a big risk factor is impulsivity. And so and substance use, when that's a part of it. And so some of the resources you really want to get people connected with are suicide prevention hotlines. There's the CDC has a lot of great resources, 1-800-273-TALK. You can call that anytime. You can get some resources, get connected. There's a lot of
1-800-273-TALK.
273-TALK.
That's for people or anybody that may recognize somebody's at risk of suicide. They
Absolutely.
can call and get help.
Absolutely. And really, one of the key things, and this is what I really want to leave your viewers with, research has shown that it does not raise the risk of suicide if you ask someone directly, are you thinking of killing yourself? It actually opens the door for them to talk about it, which is what they need.
Well, that takes a lot of guts, but obviously if it's going to save their life, it's the way to go.